So good afternoon and welcome to the National Hispanic Council on Aging Perspective from Health Researchers in Advancing Health Equity in Diverse Communities, Part 1 webinar. My name is Christine Perez and I'm NHCOA's Program and Research Development Associate, and it's my pleasure to be moderating today's webinar with Ocean Lee, the Senior Program Coordinator of the Diverse Elders Coalition. So today we are partnering with the All of Us Research Program and the Diverse Elders Coalition to host this webinar to discuss the importance of collecting health research data from diverse populations and the benefits it will provide for researchers and health practitioners. This afternoon, it is my pleasure to welcome a panel of experts that will discuss persisting health inequities and barriers that have prevented minority communities, including people of color, LGBTQ plus people, American Indian and Alaska Native communities, and others from participating in health research. The All of Us Research Program aims to resolve these inequities, making it easier for diverse communities to participate in health research. Similarly, we will also be discussing the difficulties for health researchers in reaching diverse communities to participate in health research and how the All of Us Research Program wants to resolve these difficulties. So before we begin this webinar, I want to introduce Ocean Lee, who will be moderating this webinar with me, as well as presenting polls over the course of the webinar. Welcome, Ocean.
Hi, everyone, and thank you for the introduction, Christine. As Christine mentioned, we just want to get started off with some polls, and so these polls are open to all participants. So please share your insights with us. They're anonymous, and it'll give us a better understanding on, what to present on next, and so on and so forth. So here's the first poll: have you heard of the All of Us Research Program? Option 1 is yes, and option 2 is no. This one's pretty self-explanatory, and we'll give you about like a minute, 45 seconds, a minute to respond. See the results coming in here. There we go. Okay. Those are some good results. I'm not sure. We'll probably share the results after the webinar and everything. But moving on to our second webinar. Sorry about that. Second polling question. And that is, have you heard the term precision medicine before today? And again, this one's self-explanatory. Just 2 options, yes or no. We got about 30 seconds left before we close the poll. Thank you for that. And that's it for now regarding the poll questions. Throughout the webinar, we'll have 1 or 2 more, but I'll pass it over to Christine again.
Thanks, Ocean. So many groups, especially communities of color, have been historically underrepresented in health research. Moreover, the disparity was highlighted with the arrival of the COVID-19 pandemic and how it has affected different demographic groups in the United States. Let's hear more from our first speaker, Dr. Perez, a nurse with over 20 years of experience and is currently serving as an assistant professor at Emory University School of Nursing. Dr. Epps serves as the principal investigator for the Faith Village Research Lab and also is the founder of the Altar Program, a nurse-led dementia-friendly congregation program. Her program of research involves evidence-based practices for promoting quality of life for African Americans with dementia and their family caregivers or care partners. So today, Dr. Epps will highlight barriers to entry for African Americans participating in health research, as well as the importance of research in diverse communities. So welcome, Dr. Epps.
Sorry, Dr. Epps, I just want to add to that introduction. I have the pleasure with working with Dr. Epps. We're part of the Public Health Center of Excellence on Dementia Caregiving together, part of the Health Equity Task Force on that. And she's a real trailblazer in this field in terms of working and doing research with diverse communities. And you hear trailblazers a lot, but I believe that definitely Dr. Epps is one of them. And so with that, welcome Dr. Epps. Just wanted to let the audience know about the great work we've been doing together.
Thank you so much, Ocean. I really appreciate that. And thank you all for allowing me to be here to speak about barriers to entry for African American participants and as a researcher in reaching out to diverse communities. So I don't have a PowerPoint, so I just kind of wanted to have a discussion and really be able to just go over some points. And then afterwards, hopefully you all will have some questions. But a little bit more about my work. I work primarily in African American communities, and let me rephrase, I work for African American communities, and my career goal as a nurse scholar is to promote health across the lifespan and increase the quality of life for family caregivers and persons living with dementia through evidence-based practices, research, education, and service. So majority of my work involves promoting brain health and dementia awareness in the community. And to do this, I partner with African American congregations through a program that I founded called Alter. So this is the only nurse-led dementia-friendly congregation program for African American churches. And this program works to shift the culture of how dementia is perceived in the African American and the Black community. I have also developed a culturally responsive and tailored online education program called Caregiving While Black. And so this educational program addresses the cultural reality of being Black, African American, and caring for someone living with dementia in America. In response to the community who said that they were falling in between the cracks, this course addresses healthcare navigation, management of home life, and caregiver self-care. So anyone that works in a community, better yet, diverse communities, know that it is not easy. It's not an easy task to conduct research and implement programs. And then I come in talking about a topic such as dementia, this topic that is so taboo. There's so much stigma associated around it in many communities, especially the Black community. So I'm here to discuss barriers working with Black communities, which all evolve around broken trust with healthcare systems, broken trust with researchers, scientists, broken trust with the government, politicians, and just so much historical trauma. And many times when I speak, I hate bringing up the Henrietta Lacks story or the Tuskegee syphilis study, as I attended undergrad at Tuskegee, and we learned about the study and the extensive scoring it has done to the great town of Tuskegee. There's also race-based trauma that the Black community experiences. And this is personal to me. And in my role as a nurse researcher, I'm doing all that I can to turn these barriers into opportunities. And that's how I look at it, barriers into opportunities. So often, I'm not sure if you all have heard Dr. Peggy Dilworth Anderson speak, but when she speaks, she's been speaking about having a paradigm shift where we have to find ways to build trust within communities so we can work toward achieving health equity and increase African American representation in research. So as nurses, researchers, and healthcare professionals, we can turn barriers and obstacles for the Black community into opportunities to promote health equity. And that's how I look at it. And one of the main things is we have to go to them. and not expect communities to come to us, especially communities of various or different racial and ethnic backgrounds. We need to come to them. So some recommendations I have about 5 recommendations. And the first one is learn the history of the community. So I'm putting a charge out there. I'm telling everybody, we need to go to them. And some of you all already know that. But especially if we get new team members on our team, we need to make sure they know the history of the community. It is necessary to understand the culture and community that we are hoping to serve. This takes time and also requires a person to acknowledge their own biases and that they bring them to the table. This is important, especially if you're not of the culture or the community you are serving. So I recently had to do damage control for a group that I was working with. And Black communities have been through so much. And the last thing that we want is history to be repeated. And you may say, how can this happen? We are trying to do something good for the community. But sometimes what you think is good is not really good. So for instance, the most recent damage control I had to do was related to leaders that wanted to control a product that this group of Black individuals contributed to. And this didn't go over well. And then I had to come in and help rectify the situation. And that put a lot of responsibility on me as a Black researcher because I felt I was responsible. I had to be their voice to speak up and say, no, 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 we cannot do it this way. And so this is really a good place for me to recommend for those that are doing work and research in diverse groups to have a community advisory board and actually engage with your community advisory board. So many people say, oh yeah, I have a board, I have a council, but do you really engage with them? Do you let them engage with the research? Do you listen to them? Many people establish boards and they don't engage. And so when I have a board and I introduce people to my board, I say that this is a safe place to get your questions answered before you really go out in the community. So for example, questions on what is the best way to approach an African American from this neighborhood versus that neighborhood, because we're not a monolithic group. And so I stay deep down south. I'm in Atlanta. And if I was to go to Oregon and I go in the African American community, it's going to be different. And I think we need to acknowledge that. And that's the importance of having a community advisory board. There's so much diversity within the African American community. And so you cannot assume what will work for one individual will work for everyone who identifies as Black and African American. And like I said, I had to learn this the hard way because I did go to Oregon and I thought I've been in the deep South all my life. And I was just like, okay, well, I can go up there and I can do the same things. But they really, they stopped me and they told me, no, what works down there in Georgia is not going to work up here. And so again, make sure we know the history of the community. The next thing is select the best person to represent your organization, to represent your research. So of course, many people recommend for the person to be of that community. But if not, the person needs to take time to learn that community and understand that their priority is to listen before speaking. We cannot understand what is needed if we do not humble ourselves and listen. We cannot understand what is needed to recruit and retain participants in research if we do not listen. So for example, I sent a team member to an event to represent our team. It was at church and I wanted them to recruit. Well, I received a call the next day and that person said, don't send her back. And I was like, is something wrong with her? And she was like, no, she was so nonchalant. Like she had no energy. She didn't care. She had no passion. And that came out. And so no one was interested. And that is very different than the energy that I bring or my other team members bring when we interact with the community. We really show that we care. And I have to tell you that this individual was Black and we was going in the Black community, but still she didn't connect. So you really want to select that right person to represent you. And just because I am a Black researcher, when I go into the community, it doesn't mean that there's this automatic trust. No, no, no. They still need to know what's going on. Many communities of color are not used to seeing a researcher of color or that looks like them, and they become very leery. They're like, oh, the white people sent you. And so these are the things I'm not just saying, but this is the stuff that I have faced as being a researcher, coming from Louisiana and now coming to Georgia. Georgia's a little bit better, but in Louisiana, it was like, nah, they sent you. You up to something, how much they paid you. So, it's really, really, really important for us to have these meaningful conversations. And these conversations actually started within my family, because it was my family that also felt this way. And so, having meaningful conversations leads to the next recommendation that I have. Engage in these honest conversations, have a clear message, and be careful of your word choices. So you may say, what are honest conversation? And so this entails no sugarcoating. You want to express the urgency of the topic, and you want to give the facts. Again, thinking about the mistrust and the historical trauma within the Black communities. We have to be clear with our message when approaching communities and individuals to participate in research. We are also trying to build, and I'm just going to be real with you, people can see right through BS. So you want to make sure that your conversations involve examples that relate to their respective population or group, and that is important to them. So, like I mentioned earlier, I do a lot with churches. And so I bring up tithing because that's something that they can relate to, and that's very important. And, and I make the example, if we don't make a change, older adults are your faithful tithers, and then this could stop. And so that catches their attention. So again, that took, really knowing that community, knowing what's important to them, and giving really relevant examples when you're having this conversation. The examples have to be relatable. And then also, words do matter. And I'm gonna say that again, words do matter. You cannot come in the Black community and talking about being used. Give me the names of your contacts and we will reach out to them. No way, no way. This is about mistrust and, again, the historical trauma within the Black communities. And these words are triggers. And so we really have to be mindful of that, the words that we use. I also had a individual that said, I want to meet your community advisory board. I want to talk with them and just let them know what we're offering to diverse communities. And I said, okay, sure. And when she spoke to my community advisory board, for her to connect with them, she thought she had to give an example of working in the ghetto to make her show that she's credible, she can work with them. And no, that is not the word that you want to use, especially when you're first introducing yourself. And so that did not go well. And so I know many people are looking for ways to connect with individuals, to connect with groups, but we want to be careful of the examples that we use and also our word choices. Next, I would recommend that be persistent and engage in community-sponsored activities. So many people say, oh, we cannot get diverse communities or racial, ethnic diverse communities in research. But I say be persistent. Just because you get a no doesn't mean that's no forever. And become part of that community. In my work, many say that community stakeholders, and in my work, that would be the pastor, ministry leaders, elders of the church, do not respond to calls and emails. So what do? I'm very persistent. You cannot take this as rejection. So I continue to email and call, and I do it appropriately. So it's not like every day back to back that I'm nagging them. But, I have a system where we can follow up with them. And I take this opportunity to find another creative way to deliver my message. I also show up at events that they sponsor. So sometimes I'm not even invited, but I show up in the community so they can see me. Showing up to church events, some of their worship services, I just pop in. so they can see that I'm there and I'm not going anywhere. Now, showing up alone is not the answer. You also have to participate and engage in activities. So really, really, really try to understand the community. And if they have something, do engage in it. If it is something where you're coming at, you don't want to be there in the back and say, oh, I'm just listening. You want to really interact and participate in any of the activities. This shows them that you're serious and that you're passionate. It also shows that you're selfless and are trying to gain a better understanding of the community. And this is so necessary and essential to building trust and rapport. So lastly, let's not leave our communities hanging. When we introduce programs or research, we need to also introduce sustainability. What I often see is researchers come in and introduce an innovative and great program, and then they leave after a time. So my question is, how can behavior change be sustained and true health equity, inequity, be achieved if there is no sustainability program for the program's initiatives? So there's no sustainability plan, I'm sorry, for the programs and initiatives. So, I battle with this myself and my team. We're continuously looking for opportunities so we can really support the efforts that have already been placed in the community. So it doesn't look like we're just leaving them hanging. So this could be finding additional grant funding to provide financial support, connecting them, linking them with other programs that can support them, incorporating some type of follow-up. Now, this can be hard because each group, each community, each population you work with will probably need a different plan. And so it's like they need an individualized plan of care for their community, especially for those that are on the call that are nursing, or clinical, we do a lot with plan of cares. So this is very important and significant effort has to be put toward this. So as I recap, the 5 things is make sure you learn the history of the community, select the best person to represent your organization, your research, engage in honest conversations, have a clear message, and be careful of the word choices that you use. We want to be persistent and engage in community-sponsored activities. And remember, do not leave our communities hanging. So I hope, I'm not sure what my time is, Ocean, but I hope this presentation inspires everyone to put things into action so we can reduce disparities, promote equity, and increase representation of all diverse communities, especially Black and African American individuals, into research. So as I close, many people approach me and ask me how do I do this, or when should I do it? Should I wait until I get this and that? And then I make up, then they make up so many excuses on why they can't do some of these things, why they really cannot engage in the community, and why their team can't do this. And so I hear so many can'ts. And at the end of my conversation with individuals, I just say, just do it. And that's what I really live by. I just do it. I know the principles, what needs to be done, and I just do it. Thank you.
Thank you, Dr. Epps. Very inspirational words at the end, and of course in your presentation. So thank you again for your work and also your commitment with communities of color. So again, if you have any questions for our panelists, please type them in the chat box, and we will address as many of your questions, of course, as possible during our question and answer session that will follow the facilitated discussion. So now Ocean will introduce the next and final poll question.
Thank you, Christine. Our next poll question is, I'm waiting for it to pop. There it is. How likely are you to want to participate in research? Option A, very likely. Option B, likely. Option C, somewhat likely. Option D, not likely. And option E, very unlikely. And we'll give you about 40 seconds or so to answer this question. We see a good number of people already voted. Yeah, I hope you all participate in health research. Okay, we're coming up on the 1 minute mark. All right. Giving about 10 more minutes here. I mean, 10 more seconds, geez. Or not. Thank you. Majority of people voted, so that's good. And I'll pass it back over to Christine.
Thank you, Ocean. So health research determines how treatments like medicines, vaccines, or medical devices are used. If the participants in health research do not accurately if the participant in health research do not accurately reflect the diversity of the population, it is difficult to know how different people will react to the treatments or how effective they will be. So let's welcome our next speaker, Florencia Gonzalez. Ms. Gonzalez is the co-director of the Inclusion of Diverse Populations Core under the Georgetown Howard University's Center for Clinical and Translational Science. She specializes in leading efforts to establish community academic partnerships for the inclusion of underrepresented groups in health research. She also supports investigators in the implementation of community and patient-engaged best practices. She has prior experience managing clinical trials and overseeing disparity health research within community settings. So today, Ms. Gonzalez will speak about the importance of diverse communities, including Hispanic and Latinos, in joining health research and clinical trials, the barriers that the researchers encounter from reaching diverse communities, and how researchers are advancing health equity in diverse communities. So welcome, Ms. Gonzalez.
Thank you, Christine. First and foremost, I want to say thank you to Dr. F for laying such a wonderful groundwork for my presentation. You really, I mean, it just was serendipitous. So yeah, it was a wonderful presentation. Thank you. And I actually will talk a bit more about some of the points that Dr. F presented, because my presentation is also quite focused on community engaged research. So just some quick statistics about the participation of Latinos in clinical trials. For cancer clinical trials, only about 2 to 4% of participants are Hispanic and Latinos. And, you know, as Christine mentioned, and as with the African American community, Latinos are very underrepresented in health research, despite the fact that it's one of the fastest growing population in the country. And as we, you know, it's been shared, it is really important to have diverse representation from different ethnic and racial groups, as different people may respond, you know, differently to certain treatments. So next slide, please. Okay, and Dr. Ebb touched on some of these barriers, in particular to the Latino community. In addition to having some mistrust of health research, it's also lack of awareness about what health research is. And when I've approached individuals in the Latino community before about health research, I'll hear a lot about, no quiero ser conejillo de India, I don't want to be a guinea pig. So having to share more about or educate the community members about what clinical trials are and what it's involved is a really critical element in when working with the Latino community, as there is a lot of unfamiliarity with clinical trials. Some of the other issues we see is the lack of transportation and low socioeconomic status that can impact person's ability to participate in clinical trials. Lack of awareness about trials. Simply some researchers, they're not talking to people of color about research. There could be, biases at play as well. So we've got to look at ourselves as researchers, what could be some of our potential biases. And we'll talk a little bit more about that on how to overcome some of these more challenging steps that you need to take in order to include particularly people with limited English proficiency. As we've found, some investigators, it requires extra time, it requires extra effort, and given all of the demands, clinical demands, and just trying to implement a research study, adding those elements to include people with limited English proficiency is time consuming and takes a lot of effort. And then again, lack of investment in time and resources can be a big challenge for study teams. So a lot of my presentation is going to be focused on community engaged research principles, some of which Dr. F beautifully highlighted. And I'll speak to it in regards to how we implemented these principles within a particular study that we did, the Novavax COVID-19 vaccine trial at Howard University, where we were charged with including African Americans and Hispanics in the trial. And then I'll talk a little bit more about meaningful one-on-one interactions with study participants and how critical certain conversations within that context is while screening participants, and to ensure that we're including diverse populations, but that it is a right fit for them. Next slide. Just a quick brief background on the trial. So Howard University was selected as a site for the Novavax phase 3 COVID-19 vaccine. We ran the study end of December 2020 to mid-February 2021. So we had 7 weeks to implement the study. There were many sites throughout the country. We were one of the sites. And we were charged 300 participants. We recruited 150 over a 7-week period, which we think it's still quite we worked hard to get those numbers. There is some background noise. If could ask you to please mute, I'd really appreciate it. And then it was a 2-dose, 21 days apart. And then for those that were in the placebo group, eventually ended up crossing over and getting the vaccine. Ultimately, we recruited 57% participants of a racial or ethnic background, 30% African Americans, 21% Hispanics, 5% Asian, and 1% mixed race. We'll talk a bit more about the different recruitment approaches that we undertook. Okay, so what was at the heart of our recruitment approach? It was meaningful engagement, and echoing what Dr. Ebb said about meaningful engagement, this was key. And one of the ways we operationalized meaningful engagement was through developing a community advisory board for this study. So we invited 9 members of our existing community leaders, community partners into the trial, into the advisory board. They provided input on community needs and concerns. So as Dr. F said, listening. This was the opportunity for us to listen and understand what were the community concerns related to COVID vaccine, to COVID itself. And so, and how can we ethically and appropriately recruit participants. And so one of the key messages that came out of the community advisory board is, if you're going to go out into the community, if we're going to open the doors for you, you have got to provide education around the development of clinical trials, demystify clinical trials, about COVID vaccine development, and in similar topics. So we listened and we did do just that. Next slide. So we ended up presenting at over 15 town halls and webinars. All of this took place online because of this, this was early COVID. So, and one of them was called Making It Plain, a conversation with Dr. Fauci and the Black community. So this involved Dr. Majub, who was our investigator, principal investigator at Howard University for the vaccine, this Novavax vaccine study, Dr. Frederick, who is our Howard University president, and our community partners, and Dr. Fauci presented as well. And so it was an event where we not only was there education about COVID prevention, but also it was an opportunity to promote this, the study. So all the events had this combination, some element of education and then study promotion, but the focus was on education. The promotion part was not the highlight. So that was the core, is in terms of equity. And if you're going to do health equity, if you're going to do research with diverse communities, health equity comes first. The public health aspect of what you're doing comes first, and then it's about the recruitment. So same thing, when we went out to food drives, the churches, one of our community partners was a pastor of a church. He opened up the food drive event for us to disseminate information about the trial. Again, we got educational material. The CDC was developing really good material in English and Spanish. And so we were able to create packages and for where we were using educational material and promoting the study as well. Nothing that we did with the community was just about study promotion. It was always in combination with education being the priority. We also developed tailored radio advertisement through the WHUR radio station at Howard, which is audience is predominantly African American, and Radio Sol with the audience predominantly Hispanic. Now, at those community events, we would hear people tell us their fears and some of the misinformation they had. They would share with us, well, we're afraid of the vaccine because it's going to change our DNA. I don't want to be a guinea pig. I'm going to get COVID. So what we did is we listened to those messages and we incorporated those messages into our radio ads saying, this vaccine is not going to give you COVID. It's not going to change your DNA, and you're not going to be serving as a guinea pig. You're going to be contributing to understanding and finding a potential vaccine to end this pandemic. So, we took those comments really to heart and incorporate them into our advertisement. Next slide. Okay, so our meaningful engagement extended to the screening process and of course into the whole enrollment and ongoing process of study implementation. In the screening process, one of the things that we understood was that we needed to be prepared to provide research 101 education among the Latino community, at least from my experience. People that I've contacted in the community don't always know about health research, what it is, what it involves. And so it's taking the time to provide some basic education, and that is key. Working with the diverse communities, and in my experience, particularly with the Latino community, you've got to allot time as a study coordinator or as a person who is engaging directly with the potential participant. You cannot rush the process of screening. You've got to set time to be able to have a discussion about, is this the right fit? And what are your, do you have concerns? And just really listening attentively. And one of our coordinators went as far as sharing her own experience with vaccinations and in addressing concerns and fears. So it's just really taking that extra time and not rushing through the screening process. And ultimately, we encourage the participant to do what was best for them. At that time, the Pfizer vaccine and the Moderna vaccine, they were getting emergency use approval from the FDA. So if that was the best fit for them, then by all means, we were not, we were very cognizant that this wasn't about us, it was about the person in front of us. Okay, next slide. Okay, very important. If you're going to invite Hispanic participants, especially people with limited English proficiency, you've got to be able to provide quality language access. And what does that look like? You're providing translated documents, and there is a person that can, a bilingual staff member or interpreter that can help the person make sure they're understanding fully what they're getting themselves into in the study. So you're having interpreting services and translation available, not just one or the other, both. So all documents to be translated into Spanish or whatever language that population you're working with, and making sure that you have a bilingual, ideally a bilingual coordinator, if not, that you're working with the interpreting office departments at your research centers, and they are trained in the study protocol, or at the very least are familiar ahead of time with the consent form. So that's what we did. We trained our interpreter office, our clinical, our hospital interpreters that typically interpret for clinical services. We trained them. This is really important. It got to the point where our study was so involved that we couldn't ultimately get the interpreters from the hospital because there were so many clinical demands for interpreting at that time. So we partner with one of our community organizations, and they provided an interpreter for us, and we trained them on the study, and we would pay that community partner per hour for that interpreter. Again, that interpreter was trained on the protocol. They received city training. So that's another option for working with your community partners to see if they can help you access a bilingual person to help for your particular study, as unfortunately our institutions don't always have the capacity to provide those needed resources. So that's another option. And then we also were very clear about, we're not going to ask for immigration status, social security number, or any financial information. And that's something that we spoke to the sponsor as well, and the sponsor understood that, and we all agreed that that was the best way to go. And that was really important. Okay, I'm going to move quickly through here. So again, really key is having those discussions while screening. Is this the best fit for you? I remember having conversations with individuals who work by the hour. So this study is very involved. It requires 10 different visits. The first visit is potentially up to 6 hours. So providing all those details so that that person can say, I don't know if this is the right fit because I may lose income. Because I get paid by the hour. So having those discussions, where do you live? If they're not close to the center, then can they make it to the visits? And what's your transportation like? Do you have transportation? And though we could provide transportation cost or cover transportation costs, there could be other potential barriers to coming to the visit. So what was the best fit for them, not what was the best fit for us, and that was an important discussion to have while screening. Next slide. Okay, budgeting, very important. You cannot do community engagement or meaningful engagement or include people with limited English proficiency, diverse populations, without budgeting. And if it is a sponsored trial, a pharmaceutical sponsored trial, negotiating with them from the very beginning to help you budget for these community engagement needs and for translation services, interpreting services. Just because you have a bilingual study coordinator does not mean that it is their job to translate the consent form, to translate all the different documents. Sometimes I translate a flyer or maybe a simple document, but I personally don't have the time to translate a big document. That will take time away from being with potential participants or doing community engagement events. So budgeting for translation services, budgeting for interpreting services, and contacting your interpreting service department at your research center or the hospital, medical center, whatever it may be, and asking them, what is the interpreter availability? If you have an intense study like the way we did with the Novavax trial, you may want to consider offsetting costs, budgeting for paying the interpreting services so that all the cost is not incurred by the hospital, and that may motivate them to be able to provide those needed interpreting services. So that's something I think that's important to keep in mind. Lessons learned, it's a commitment because it takes extra effort, it takes extra time to be able to include diverse communities. It's really important to be committed as a team. If you're not committed, it's not going to work. And start CAB development early, months prior to enrollment. I'm part of what's called the CTSA, the Georgetown Howard University Center for Clinical and Translational Sciences. We provide consultations, not just to our investigators within our institutions, but investigators at other sites on CAB development. We have tools, resources, toolkits, which we can share with you through, but first we can do a free, a no-cost consultation. So I'm going to put my email in the chat. So if you are an investigator or if you are even a community organization interested in doing research, and we're happy to do some no-cost consultation to get you on your way, whether it's CAB development, whether it's collaborating with community organizations, how to go about doing that. We can provide that kind of coaching support. And if you are part of a CTSA, utilize your community engagement, your recruitment, core services. They can be very helpful. And as Dr. Epps shared, listen attentively, whether you're out in the community, whether you are screening a participant or enrolling a participant, listen attentively to the needs and see where possible to adapt. It's not always possible to adapt your approaches or change structures to help with the recruitment of diverse populations, but where possible, it's worth it in making that investment. Thank you.
Thank you, Florencia, for your presentation, as well as your work in engaging with Hispanic and Latino and diverse communities as well. So let's begin right now with the question and answer session. We have a lot of questions, but unfortunately, due to time, we will need to limit them a little bit, but Ocean will begin this part. Thank you, Ocean.
Yeah, and for the unanswered questions, we'll try to answer them through email, etc. But yeah, we'll try and get through this quick. So the first one, any tips on repairing a breakage of trust? I work for an organization that has made some missteps guided by staff who are no longer with the organization. The community is right to be skeptical of us based on history, but how do we overcome that? And this one's, I think, directed at both Dr. Epps and Florencia, so feel free to take it away.
Dr. Epps, please.
Okay, yeah. So I think what it's just realizing it will take time. And it's introducing little by little, inviting them to certain things that you all may offer, and also take that extra step to do things for that particular community. So, you know, it's always not take. And so really maybe seeing how can you all give, you know, in the beginning so they can see that, meet the new administration, meet the people, the team, and then you can start building trust and rapport there. Florencia, you had anything to add?
I'll just add that one of the things that we do is we ask our investigators when they want to partner with community organizations for research is, what can you offer in addition to budgeting for the partnership or the engagement? Can you go out and present on expert topics? or health topics in the community. Can you open up, is there a meeting room you can allow them to come into and use on campus if that's something they would like? So just looking at the different ways that you can support your community partners. Yeah.
Awesome. Thank you, Florencia. Thank you, Dr. Epps. I think we have time for one or two more questions. This one's for Dr. Epps. What are some best practices you recommend for creating a community-based advisory board? And feel free to comment on this, Florencia, as well.
Yeah, so I think what do I follow? Because there's no right or wrong, I would say that. So whatever I tell you all, don't put it like, oh, it has to be like this. But I think the first thing is identifying how many people you want to be on your community advisory board is really key. So I have between 8 to 12. And then I think of the structure. So before I even go out and start inviting people, I think about how I want this community advisory board structured. So as it relates to the number of people, how do I want their terms to be? Is they going to will they always serve on the board, or will they have two-year terms, 1-year terms, so we can always have fresh ideas? So it all depends on the purpose of the community advisory board. And then I think about, who do I want on the board? Right? Who are the community members? Are there any leaders? Do I want patients on the board? And I think, spending time to understand, to decide on that early on. And so then it leads you to your next step on who you will invite. And I have letters. So I just don't say, hey, you want to be on my community advisory board? No, I actually have a letter. So it entails those details, what it will be like, how often we'll be meeting. So all this background stuff that I kind of, the structure stuff that me and my team came up with, it's all in the letter. And then I have them sign it, because then it takes it to another level of commitment when they do sign. And then on my board, you can have a 2-year or 1-year term, and I allow them to select what term they would like to serve. And so that's the beginning steps, I say, for anyone. And again, I think trying to think about the structure of it before you invite anyone is going to be really key, because they're going to have questions. But now when I do invite people, they don't have questions because I have a letter and it has everything entailed in there, what they need to do. And then also providing honorariums is very important for their time. Because especially if you have community members that are taking off of work, I mean, you just really have to, and I don't mean $10, not. If you're meeting for an hour and a half, you really want the honorarium to be, really align with what they may be missing if they were working for that hour and a half, according to your geographic area. So I think that's really, really key, not asking them to give their time, and we don't give anything back. Florencia, you want to add anything?
Yes, I agree with everything that Dr. Epps is saying, and we do have a roles and responsibilities document. We have the letter as well with all the details to be very transparent as to the commitment, their commitment, what you're asking of them in compensation. I'm happy to offer consultation we do actually do this at our CTSA. We do consultations for investigators on CAB or PAD, Patient Advisory Board Development. If Christine, you could feel free to put my email address on the chat, and you feel free to reach out to me. We can set up a no-cost consultation, and we can do up to 2 1-hour consultations. Plus, we can provide resources or examples to you as well. But it's a lot, because of this, for the sake of time, it's a lot easier if we could talk about it. If you're interested, we could talk about it and set up some time to really go into more detail.
Thank you for that, Dr. Epps. Thank you, Florencia, and the offer for a consultation. We have time for one more quick question, and I think it's just a yes or no question. But It says, thank you, Dr. Epps. Is there more information available about your outreach strategies, for instance, about your online education program?
Yes, and so if you just type in Faith Village Research Lab, then all of my work that I do in the community and all of the active programs that we have will be listed there where you can get more information. So I'm not sure how to put anything in the chat box, but Christine, feel free to put the Faith Village Research Lab, and then you can share my email and my phone number.
I did that.
If anybody wanted more information, yes.
Awesome. So I think that's all we have for today in terms of questions, and I will pass it back to Christine to close us off.
Thank you, Ocean. Thank you, Florencia, and thank you, Dr. Epps. For sure, we will be providing all the information via message or via email as well to all of our attendees. And before ending today's webinar, I want to provide a brief overview of the All of Us Research Program, which was created by the National Institute of Health. The program aims to enroll 1 million volunteers living in the United States of any race, ethnicity, sex, gender, identity, or sexual orientation without discrimination. The program wants to include these volunteers from diverse backgrounds in a database that can help researchers to better understand how diseases develop and how we might be able to treat them in the future. So stay tuned for the second part of the webinar on June 23. Speakers will include health researchers from the All of Us Research Program discussing their experiences and the benefits of using the program's database. We will also provide important data in aiding the development of precision medicine and advancing health equity for diverse communities. So again, thank you to our sponsor, our panelists, and to all of you, our attendees, for joining us for today's event. So we invite you to follow us in our social media platforms as well as our website for the latest information about participating in research and for upcoming webinars. Thank you so much. Until the next one. Bye-bye.
All right. Bye, everyone.